Good day, this is Charles Asalasta from BSN 12H. In this video, I will be performing a return demonstration on immediate newborn care. So every newborn needs immediate care to minimize spread of infection and maximize optimum growth. So before starting, I've already washed and sanitized my hand, and I have also prepared the materials needed to help us to be efficient and save time. So now, we'll properly identify the infant by checking the wrist tag of the infant, and this is for us to make sure and know the baby's name so that we can record the process appropriately. Okay, so and then we'll also adjust the heater. Uh, so this is to enhance the infant's comfort by keeping the environment warm. So this is essential as newborns are at risk for hypothermia because of lack of fat and wetness during birth. After that, we'll then again have to wash our hand and sanitize it before wearing our gloves. So this is to avoid cross-contamination which can lead to infections. Before that, I'm going to sanitize my hands and use gloves. Okay, now I already have put on my gloves. So now we can now proceed to weighing the baby. So this is for us to have a baseline data of the baby's weight. So for monitoring. Okay. Okay. Next, we'll now proceed with the cord dressing. Okay, now I've already put on our gloves. So now, we'll restrain the baby's extremities properly. So this is to avoid unnecessary movements which can cause injuries. First is in the arm of the baby. After that is the legs. Okay, so then using a gauze with alcohol will disinfect the cord 3 times base, then upward. Okay, so base, then upward. And another cotton ball, base, and upward. And the last one, okay. After that, we'll place a sterile gauze pad at the base of the cord. Then clamp the cord with umbilical clip at 1 to 2 inch from the base. So clamping will help stop bleeding from vessels in the umbilical cord. Okay. First is I'm going to put gauze pad on the base of the then the umbilical clip with the 1.5 inches. This one. Okay, so after that is we'll cut the cord for about 0 to 5 centimeters above the cord clip, and then express the remaining blood from the cord using the gauze pad at the base of the cord. Okay, I'm going to cut this. Okay. Going to put this. Going to just wipe this gauze pad and discard it as well. And then we'll place a new gauze pad at the base of the cord, and then we'll pour 70% alcohol solution all over the cord to disinfect it. Okay, I'm going to get in this base on the cord. Then I'm going to pour to properly disinfect it. Okay. Okay, and after that is discard it as well. Then put another gauze pad. After that, after cord dressing, we'll now proceed through the injection of vitamin K. So newborns doesn't get much vitamin K from their mothers at birth. That is why injection of vitamin K is necessary to provide the baby with protection against potential bleeding due to low level of vitamin K. So we'll withdraw the exact amount from the ampule and then inject it in the middle third lateral aspect of the infant's thigh, because this area of the baby have larger muscle mass compared to the other section sites. Okay. For that, I am going to open this and I am going to inject the thigh of the baby. Okay. So next is we'll get the anthropometric measurement in centimeter for baseline data and for the future monitoring purposes. Okay, so we'll start with the head circumference. Okay. Okay, it is 43 centimeters. So, and then with the chest circumference, going to spread the pad and then going to apply the area with the infant's chest. Okay. Okay, it is 43 centimeters. And then the abdominal circumference. So it is done for 44 centimeters. And lastly is the length of the baby. Okay, so the baby's length is 40 centimeters. And then we'll also get the temperature of the newborn via rectal. So this is because getting the baby's temperature rectally will help us determine if the baby has a butthole, and this side is also one of the most accurate when it comes to getting the internal body temperature. So I'm going to get the temperature, uh, the thermometer rather, and then first things first, else we'll need to disinfect the tip of the thermometer to prevent cross-contamination and infections. Discard it. Okay, I am going to put this in the butt of the baby. Okay, done. Now the next procedure is the infant bath. So we bath the baby as immediate as possible to remove undesired fluids such as blood and meconium on the newborn's body and to provide hydration. Okay. Going to wash the baby. Okay, so hold the newborn in the football grip manner, folding both ears. So then carefully wash the newborn's head with the use of baby soap or mild shampoo, and then wipe them dry thereafter. Okay, I am going to wipe the baby with this dry then discard it as well. So after bath, we'll dry the baby thoroughly and then let them wear diaper and their clothing. So after that, so first we'll we'll need to remove the sterile gloves that we've uh, put earlier. So that is this discard it. And then after the bath, we'll dry the baby thoroughly and then let them wear diaper and their clothing. Okay. Now we are going to put the diaper on the baby. So that is the cup. Okay, after clothing the baby, we'll now wrap them securely with clean blanket. So this will help in keeping the babies warm. Okay, and then after that, we'll place the baby on the crib while with drop light. Okay. Well, then, and apply ointment or Credis prophylaxis for infants' eye protection. So we'll shade the newborn's eyes from the light and then open one eye at a time by gently exerting pressure on the upper and lower lids. So then we'll drop the ointment from the inner to outer canthus, making sure not to touch it to the baby's eye. Okay, first is the right eye, and after is the left eye. Okay. So we'll also take the vital signs of the baby. We've already got the temperature using stethoscope to get the heart rate and respiratory rate. Okay. Okay, I've done getting her heart rate. And we're now done with the procedure for our newborn care. So we'll now do an aftercare. So we'll remove our gloves and arrange and dispose the used materials properly. Okay, so after that, we'll perform hand hygiene, then record the procedure done and make sure to document all data gathered for the future monitoring references. Okay, first I am going to that eyes. So it is also necessary to wash your hands after everything and answer related questions on the procedure. Okay.